So UPTurn's important for a lot of reasons. It definitely fills a gap at the university in terms of addressing the specific mental health and wellness needs of public health and health professions students.
And a lot of the students here are in very high stress positions. A lot of them are pre-med or pre-health in some way. So they're under a lot of stress and may not have as ease of accessibility with the CWC or other resources, especially if they're taking classes in this side of campus, whereas everything else is kind of on the main side.
First step of the process is to schedule with us for a 45-minute consultation session. And we go over just different presenting problems that you might be dealing with in your life, whether they are health-related, whether they are school-related, family-related. You can come to us with anything, and we try to develop an individualized plan to help meet your needs. If you feel comfortable after the consultation session and you've received all the resources and skills that you feel are necessary to kind of continue to launch yourself in your program, then that's great. But there are also additional options if you're just feeling a little bit stuck still. So the next step after the consultation, if you're interested, is to schedule skill sessions with us.
So traditionally in therapy, we dive into a lot of different things. Here in our clinic, we do an episodes of care. So we have very specialized clinics. So one of them is a sleep clinic. So we do up to 7 or 8 sessions of just sleep. But usually we dive into other stuff too, right? Life happens, so we talk a lot about anxiety and things like that come in and, kind of mess up with our sleep. Here, the skill sessions would be more focused on specifically that one thing. So like for stress relief, that's all we're gonna work on for those sessions. For sleep, same thing, that's all we're gonna work on. It's very, very focused.
Top things that students come to us for are stress management, time management, sleep hygiene, just basic or more intermediate advanced study skills. So we spend up to 4 sessions honing those specific skills. And then if a student still feels like there is a mood or anxiety component that is affecting their lives on a greater level and they want to dive into more of those specific concerns in their life, then we can tackle those in the next up to 8 to 12 sessions of psychotherapy.
So the psychotherapy sessions would be to just kind of parse them apart a little bit, talk about them in more extended ways, bring in other skills separate from just one focused skill. So we can talk about sleep, we can talk about stress, we can talk about just other things that may be impacting you in that moment and ways to cope with that and work through it.
If you are a student that is taking a PHHP course, or if you are in a PHHP major or minor, you would qualify to receive our UPTurn services. So if students are interested in scheduling a consultation session with us, they're welcome to visit our website, learn more about us, and fill out the consultation request form. They can also shoot us an email at upturn@phhp.ufl.edu, or they can give us a phone call as well if they would prefer.